Thank you, and thank you very much to ILSI for the opportunity to join this panel this morning. My disclosures, such as they are, I don't get out much. You've heard a lot of definitions of discretionary fortification, so I'll move swiftly here. Basically, I'm talking about fortification that it happens at the discretion of the manufacturer and without any demonstrable public health need, or at least not part of a strategy, a broader plan strategy. The identification of things that are discretionarily fortified is a bit messy because of differences in our regulatory systems. In Canada, where fortification is mostly mandatory, it's quite easy to identify discretionary fortification as that which is not mandatory. In the United States, it's more complicated, but others have offered definitions, and here I've offered a very simple-minded comment about discretionary fortification in the US being things that fall outside standards of identity or other sorts of defined nutrient additions. To make that a bit more real, I offer you a few pictures. This is just a very haphazard sort of sample of discretionarily fortified foods, or what I would consider discretionarily fortified foods that are currently available in our supermarkets. You can see beverages and cereals, and I looked, but I could also have added some sorts of bars. These products have arrived to the marketplace through a variety of regulatory routes. They may have come in as supplements or dietary supplements. They may have come in as meal replacements. In Canada, many of them now bear the stamp of temporary market authorization letters. So there's a variety of routes in which they come, but what they have in common is that they're fortification that is outside a planned public health program. A few years ago, we did a look at novel beverages that were being sold in Toronto supermarkets as part of a larger initiative to look at nutrition-related food marketing. We identified beverages that at that point were discretionarily fortified as evidenced by the fact that they were natural health products, which was the regulatory framework for them at the time. Our sample included things like energy drinks, vitamin waters, and nutrient-enhanced fruit beverages. Here you see what those products were containing. The most prominent nutrient additions were B vitamins and vitamin C. Many of the additions are for nutrients for which we have no evidence of need. I've compared here the nutrients to prevalences of inadequacy for young adult men who appear to be a primary target for the marketing of many of these beverages. And as you can see from the B vitamins, we have no discernible prevalence of inadequacy for those vitamins in our population. There are two nutrient additions on this chart that we don't even have any data for, pantothenic acid and chromium. We have no intake data to enable us to know whether or not the population is getting enough pantothenic acid or chromium, but they are nutrients that are found in many of the products we sampled. A more current reckoning of these beverages, or at least a few of them, gives me this example. Here I've got 3 energy drinks, and what I'm presenting to you are the percentages of daily values for the B vitamins that are shown there. And what you can see is that many of these nutrient additions are several hundred times the daily value. Just to give you a bit better sense of what that means in terms of actual amounts, this is my very crude graph for riboflavin. At the left-hand side of the slide, I've given you a nutrient requirement distribution for riboflavin for a young adult male, the target group, I believe, for these products. And then you see the amounts of riboflavin in Monster and Rockstar, 3 and 8 times the nutrient requirement for riboflavin as we've currently defined it. And remember, this is one can that contains that amount. Here's vitamin B12, and you can see again a similar story. Now Red Bull joins the picture, but nutrient additions that are several times our best estimate of nutrient requirement for these nutrients for an entire day, but in one can of the product. Lest you think this is only a story about energy drinks, we can also find vitamin waters that are sitting in those higher ranges for at least B12. What's the relationship between discretionary fortification and daily values and the product promotion? It's an important question, I think, to ask, because in our field, we've spent a lot of time in the last decade talking and arguing about what the daily value is and what it's based on. And a big part of that conversation has been about how changing the daily value might relate to changing the nutrient concentration in foods. You can see on the front of this Fruit Loops box that there's a promotion of vitamin D that relates to the daily value, so 20% of the daily value in a serving of Fruit Loops. Contrast that to this Starbucks product, where the front of package is telling us that the product contains B vitamins, but there's nothing in the marketing that alerts you to the fact that these B vitamins are coming in at 200 or more % of the daily value. Here's a front of package for a vitamin water, 0, so not a vitamin water with any energy contribution, but with substantial amounts of some B vitamins again, and also vitamin C. The front of package marketing, in case you can't read it, begins with celebrities just eloped, a movie star announces she's pregnant, the interview with that new superhero is being rescheduled, and it kind of carries on until eventually we get to a point where the conversation on the front of this bottle takes us into the idea of hydration and getting some vitamins and minerals. It's in a delicious, naturally sweetened beverage is, a great way for me to carry on. I offer you these examples to flag that discretionary fortification, or much of it, appears to be disconnected from our conventional notions of the daily value and the relationship between the daily value and regulated language around nutrient content claims or diet-related health claims. That would suggest that then this genre of fortification will be insensitive to changes in daily values. We are unlikely to reel back in the amounts of B vitamins in these products if we change the denominator, because the marketing has nothing to do with it. What are the health implications? Well, for that we have to look at, I think, or at least a starting place is to look at the total exposure. So we attempted to do that using data from 2007 and 8 NHANES. Our interest was in looking at the impact of discretionarily added nutrients on total exposure. We looked at nutrients for which there were defined ULs. Discretionary fortification was not flagged in the database. We attempted to infer it by first looking at foods that were fortified, removing those that appeared to be fortified in relation to a standard of identity, and then looking for other cues that would tell us that the product was discretionarily fortified. We then attempted, through the fine footwork of one Mr. Kevin Dodd, we then attempted to divide the population into quintiles of exposure based on the propensity to consume whatever the nutrient in question was from discretionarily fortified foods as we had identified them. So just to give you a sense of what that looks like, here you see the cumulative distribution function for usual calcium intakes from food alone. We didn't include supplements in this analysis, and this is for men 51 to 70. And what you can see is 5 lines there, and as we move higher up in the quintile, so the highest quintile of likelihood of consuming calcium from discretionarily fortified foods, the distribution is higher. And it's moving in a stepwise function across the quintiles. Just to give you some parameters against which to interpret that, I've overlaid the estimated average requirement and the tolerable upper intake level for calcium. What you can see again then is that with greater likelihood of consuming discretionarily or calcium from discretionarily fortified foods, there is a lower prevalence of the distribution below the EAR, so a lower prevalence of inadequacy, but there is also a push towards the UL within the 5th quintile, the distribution now passing the UL by a small amount. Here's a look at zinc for children 1 to 3 years of age. And you can again see us breaking open the quintiles by probability of consumption. The lines are quite close together. Our estimate of the consumption of discretionarily fortified foods or zinc from discretionarily fortified foods didn't discriminate very much here. All of these distributions are sitting well above the EAR and above the UL. Although there is a slight increase in the proportion above the UL as you move across the quintiles. Here's the picture for retinol for 1 to 3 year olds as well. And you can see more separation now based on the propensity to consume retinol from discretionarily fortified foods, such that if you look at the proportion of the distribution above the UL, we move from 15% or 16% in the lowest 2 quintiles to 30% in the highest quintiles. So the likelihood of consuming retinol from discretionarily fortified foods substantially increases the probability of being above the UL. Our most dramatic finding in this entire exploration was for iron for men 19 to 30 years of age. And here you can see a very sharp distinction where the likelihood of consuming iron from discretionarily fortified foods really shifts the distribution in that 5th quintile, such that now we start to see the distribution surpassing the UL only by a small amount, admittedly, but in a way that doesn't happen when we look at the lower levels of consumption. These are estimates, and they're based on our inferences of discretionary fortification. It is important to stress here that every single error in this activity is towards underestimating the impact of discretionary fortification on intakes. Every single one. We don't have a database that has systematically differentiated discretionarily fortified foods from unfortified options or from mandatorily fortified options. We have not got an interview procedure in place for the 24-hour recall that is systematically probing for was that a discretionarily fortified food, was that a fortified food option or not. Both of those things would lead us towards underestimation. On top of that, we are working with a data set for which there is a well-documented problem of underreporting. So against all of that, we still have managed to find some differences, not many statistically significant differences, but some patterns in this data set that suggest that higher consumption of discretionarily fortified food associates with a higher probability of intakes in the upper zone. What difference does it make? Well, what is the potential for harm that comes from discretionarily fortified products? And the short answer to that question is we don't know. What we know is that where we and others, I mean, you saw a lot of this material presented by Reagan Bailey and earlier by Chris Taylor, we know that to consume fortified foods is to have a higher probability of intakes in the upper zone and intakes that surpass the tolerable upper intake levels. We also know that to consume supplements is to increase the probability of high intakes and intakes above the tolerable upper intake levels. We also know that supplement use and fortified food consumption go hand in hand. These are not behaviors that are randomly distributed in the population. The consumers of discretionarily fortified foods in that study were more likely in many age and sex groups to be also consuming supplements. What we don't know is what the consequences are of chronically high intakes. Even though we've got defined tolerable upper intake levels, you've already heard some comments about this, and I'm sure you're going to hear more, we don't really know yet what the health implications are of having intakes sitting above those tolerable upper intake levels. More importantly, for many of the nutrients that are being added through discretionary fortification, we don't even have tolerable upper intake levels. So we know that the nutrient loads are substantially higher than requirement estimates, but we haven't really got any sense of what the health consequences are of chronic consumptions of intakes at that level. So we're working with a backdrop of fortification right now against a science in terms of at least harm that is still very much in its infancy. That said, we need make, I think, no apologies when we ask the question of what is the potential for benefit. Well, it's a relatively new thing in nutritional sciences for us to try to isolate and determine tolerable upper intake levels and thresholds for toxicity, however you want to use that term. We've actually spent centuries in this field figuring out how much of a nutrient people need. That science, I would suggest to you, is very well established. And what do we know then? Well, we've seen examples from Reagan this morning that we can see where fortification has effectively lowered the prevalence of inadequacy for some nutrients. I think that most of what we're seeing in those instances are the impacts of plant fortification, fortification that has been introduced as a public health strategy in response to concerns about inadequacy or refinements of cereal grains that would lead to inadequacies, and this has been a response and it's been effective. Whether discretionary fortification will have similar benefits is an open question. It completely depends on what manufacturers choose to add. In the products that I've shown you as examples here, I've shown you added vitamin D, which some might argue is food industry being proactive and fortifying it through discretionary routes right now to add vitamin D to our food supply in a way that will respond to what is perceived to be a public health need, and maybe eventually down the road we'll start to see mandatory vitamin D fortification. Who knows? Some are talking about it. But contrast that conversation about vitamin D, where we do have, at least recognizing Chris's caveats, we do have some evidence to raise questions about the adequacy of vitamin D. Contrast that to the prevalence of vitamin B additions in discretionarily fortified foods, where we have very, very little indication of inadequacies in our population, but very large doses in many discretionarily fortified products right now. Whether or not discretionary fortification has a benefit depends on what manufacturers do, and on top of that, it depends on which portions of the population consume the products. We have no evidence that usual intakes above requirements are of benefit. We have absolutely no evidence of that. Our best estimate of what people need are the requirement distributions. We have nothing to say that intakes chronically above that, whether or not they surpass the UL or whether we've got one. We have not a speck of science to say those intakes higher than requirements are beneficial. In the absence of benefit, all we have then is a question about, do we have any harm? The evidence that I'd suggest is most relevant in asking the question of what benefit can be derived from chronically high loads of micronutrients, I think comes from the ever-growing body of literature on supplement use. We keep seeing papers coming out in our field now looking at long-term studies of longitudinal cohorts consuming vitamin and mineral supplements, and the question on the table is there a benefit? Has there been any prevention of chronic disease? And typically the answer is coming back or no. So we're working, I think, in a zone now where we've got a lot of nutrient additions that appear to be gratuitous, above and beyond requirement estimates even in a single dose, and with no argument in place to say that these things are beneficial. Why not just leave it up to the consumer to make choices? I think the argument against leaving this question to the consumer is that it is absolutely impossible for consumers to make informed choices when it comes to supplements and fortified foods. The only tool at their disposal is the Nutrition Facts Panel. And that facts panel communicates absolutely nothing about need. So it's impossible for someone to look at these panels and make a decision about whether or not they stand to benefit from the consumption of that product, let alone to sum up all of the facts panels in their day to figure out what the total benefit is. Going forward in terms of recommendations for future directions, I would suggest 3. As we roll forward in what is unquestionably a natural experiment with fortification and discretionary fortification in particular, I think it is imperative that we monitor the practice. That means doing the hard and expensive work of keeping food composition tables updated so that we actually have the ability to know what is in products that are being consumed, and designing dietary intake surveys such that they probe consumption of discretionarily fortified foods so that we're able to distinguish behavior patterns. I also think it's important that we design surveys to facilitate the examination of behavior patterns amongst discrete population subgroups that are more likely to be exposed to fortificants and supplements. What I think our exploratory work with the 2007-8 NHANES illustrates is that these are different population subgroups, at least for some nutrients. We need to design surveys in a way that we can peel off the supplement users or the high consumers of fortified foods and ask the question of what their exposure is and how does that relate to clinical or biochemical indicators of either adequacy or vulnerability. There is also a need for better tracking to look at incidence of known adverse effects. But more importantly, we have a very, very urgent need for more research to understand the consequences of exposures that are at this level. We're working now with population data where we have exposures to micronutrients in ways that could not be achieved before through natural sources. So it's incumbent upon us, I think, to do the work now to figure out what that means. Thank you.